This NHS letter gives you a 90% chance of beating the UK's second biggest cancer killer. But millions of Brits are simply binning it. Find bowel cancer late, at stage 4, and your survival odds plummet to just 1 in 10. That life or death gap is exactly why the NHS Bowel Cancer Screening Programme exists. It's designed to find cancer before you have a single symptom. Today, we're breaking it all down for you. The Simple Home Test Kit. What an abnormal result really means. Demystifying the follow-up colonoscopy. And the red flag symptoms you must tell your GP about. This information could save your life. So, who is this screening actually for? Here's what most Brits don't know: it's designed for people with absolutely no symptoms. The truth is, your risk of bowel cancer shoots up as you get older, with most cases found in people over 50. That's why the NHS automatically sends a free screening kit to your door every 2 years. In Scotland and Wales, this starts from age 50. In England, the programme is expanding right now, lowering the age from 60 down to 50. And in Northern Ireland, you'll get your first kit from age 60. The goal is brutally simple: to catch bowel cancer at its earliest stage. That's when treatment is most likely to save your life. But your GP may not tell you this: the kit does something else incredible. It also finds tiny growths called polyps. These aren't cancer yet, but they could turn into it. Getting them removed is one of the most powerful ways to prevent cancer from ever starting. So, let's be clear. Getting a kit in the post doesn't mean the NHS thinks you're ill. It's a routine, life-saving check for our age group. So, what's inside this life-saving letter? It's a simple device called the Fit Kit. Here's what it does: it finds tiny, invisible traces of blood in your poo. The truth is, polyps and even very early cancers can sometimes bleed, and this test is designed to spot it when you can't. What's shocking is how simple it is to use. The kit has a small tube with a little stick. All you do is collect a tiny sample of poo, scrape the surface with the stick, and seal it back in the tube. Seriously, that's it. No special diet needed. Then, just pop it in the prepaid envelope and into a post box. Now, listen up, because this is the part everyone worries about. A positive result does not automatically mean you have cancer. Your NHS GP may not have time to explain this, but it simply means blood was detected and they need to find out why. It could be something really common like hemorrhoids. But here's the key: it's a vital first signal. And it's one you absolutely must follow up on. The truth is, for the vast majority of people, this is a one-and-done deal. For a massive 98 out of 100 Brits, your result will come back clear. You'll get a letter saying no more tests are needed, and you'll simply be invited again in 2 years. Easy. But here's what you really need to know. For the 2 or 3 people in every 100 with an abnormal or positive result, the NHS acts fast. A specialist screening nurse will personally call you to explain what's happening and to arrange a clinic appointment. Now, your NHS GP may not tell you this, but this is an urgent referral. It's part of the 2-week wait pathway, meaning you are fast-tracked to see a specialist. The goal? To find out exactly what caused the blood to be in your sample. And they do this using the gold standard, a colonoscopy, which gives doctors the best possible view of your entire bowel. Let's be honest. The word colonoscopy makes most of us a bit anxious. But here's what most people don't know about the procedure. A specialist uses a tiny camera on a thin, flexible tube to look at the entire inside of your large bowel. Now, the truth is, the toughest part isn't the procedure itself. It's the prep. Your bowel needs to be completely empty for the camera to get a clear view. This means a special diet for a couple of days, followed by strong laxatives. For the procedure, you're usually awake, but you'll be offered sedation or pain relief to make you comfortable. It's over faster than you think, typically 30 to 45 minutes. But here's the game-changing part your GP might not have time to explain. A colonoscopy doesn't just find problems, it fixes them. If the specialist sees any small growths, called polyps, they can usually be removed right there and then. What's shocking is that most bowel cancers develop from these polyps. So by removing them, this procedure doesn't just find cancer, it actively stops it from ever developing. It's one of the most powerful cancer prevention tools we have. Here's what most Brits get dangerously wrong. That free NHS screening kit? It's for people who feel perfectly fine and have zero symptoms. The truth is, if your body is already sending you signals, you cannot wait for a letter to drop through your door. You need to call your GP. So, what are the red flags? First, seeing blood in your poo or when you wipe. Second, a persistent change in your toilet habits. That means looser poo, diarrhea, or constipation that lasts for 3 weeks or more. Also, look out for unexplained weight loss, or a nagging pain and bloating low down in your tummy. And here's something your GP might not mention straight away: feeling unusually tired and breathless. It could be a sign of anemia, which is sometimes linked to bowel cancer. Now, don't panic. Having these symptoms doesn't mean you have cancer, they're often caused by other things. But here's the deal, they absolutely must be investigated. Your GP can use tools like a fit test, as recommended by NICE, but that process only starts when you make the call. So, what happens if that screening test, or a trip to your GP, finds something? Here's what most Brits don't know about the next step. It's called staging. And honestly, it's everything. Doctors use a simple scale, from stage 1 to stage 4. It just describes the size of the cancer and if it started to spread. But the truth is, this number is the most important factor for your survival. Just look at the UK stats from Cancer Research UK. What's shocking is how much the numbers change. For bowel cancer found at stage 1, your chances are amazing. Over 90% of people survive for 5 years or more. At stage 2, it's still about 85%. Even stage 3, where it's hit nearby lymph nodes, survival is still over 60%. But stage 4, this is the one we have to avoid. The cancer has spread to the liver or lungs. And 5-year survival drops to just 10%. That cliff edge drop from 90% to 10% is precisely why the NHS screening program exists. It's all about catching it at stage 1 or 2, giving you the absolute best shot at a long and healthy life. So, what's the one thing we want you to take away from all this? When that NHS letter and your little blue and white fit kit pop through the letterbox, please, don't just put it on the to-do pile. It's a brilliant, simple home test that can spot signs of bowel cancer early, when it's much easier to treat. An unusual result will lead to a follow-up, usually a colonoscopy, which can find and remove growths before they even become a problem. But crucially, this screening is for people without symptoms. If you're worried about any changes that won't go away, please don't wait, have a chat with your GP. If this helped you, share it with someone you care about.